So next we have the discussion about the blood transfusion reactions. So patient develops 10 minutes after the blood transfusion fever, tachycardia, hypotension, and agitation. So what is going to be your diagnosis? Would it be a non-hemolytic febrile reaction? Would it be transfusion associated acute lung injury, bacterial contamination, air embolism, or hemolytic transfusion reaction? So, as the patient develops this complication immediately, so it will be an acute hemolytic transfusion reaction, which is in most of the cases is because of the ABO incompatibility. And for that, you have to stop the transfusion, and this is a medical emergency. So let's have a discussion about different transfusion reactions. How can we differentiate between them on the basis of their duration and clinical features? And what will be our immediate steps to prevent or go with their complication? So first of all, we have the acute hemolytic transfusion reaction. Now, it will develop within minutes, as in our case, 10 minutes. So, 5 to 10 minutes or even 15 minutes after the transfusion starts, and the patient will develop fever, hypotension, agitation, a decrease in the urine output, or even hemoglobinemia. That is, the urine will become red in color, and the patient may develop loin pain. So, that all will be the giveaway for the acute hemolytic transfusion reaction. So, what is going to be your management? So, you have to immediately stop the transfusion, give the patient IV line, give the patient a Foley catheter, and start the patient on IV fluids. Now, in the fluids, you can also add mannitol as well. And if the patient does not improve, then you might be requiring an ICU care for this patient. Now, in addition to these things, there are certain things that you have to add as well. So, in this patient, once you are giving the patient adequate fluids, you have to make sure that the urine output is more than 100 ml per hour. And in addition to this, you also have to perform the alkalinization of the urine, and you make sure that the pH is more than 7, and you do so by giving the patient sodium bicarbonate. So this alkalinization of the urine will prevent the hemoglobin crystals from laying down and resulting into more and more kidney damage. Then we have the febrile non-hemolytic reaction. Now, it will take around 30 to 60 minutes. However, the patient will develop fever and chills, but there will be no hypotension and no hemolysis. So, these are the two key features which will differentiate between the acute hemolytic and febrile non-hemolytic reaction. So, for the febrile non-hemolytic reaction, you have to stop the transfusion and you give paracetamol and just observe. Then we have the transfusion associated lung injury. It will take within 6 hours to develop, and this patient will develop acute respiratory distress. How it will manifest? It will manifest in the form of decreased inert saturation, and the patient can develop tachypnea as well. Now, on the X ray, there will be bilateral infiltrates, and hypoxia is going to be the most important giveaway for this. Now, for this, again, the most important step in every transfusion reaction is to stop the transfusion. Now, for this, you will get the respiratory support from the respiratory medics and shift the patient to the ICU. Now, bacterial contamination will take around 30 minutes to several hours. Now, again, in this, there will be high grade fever, rigors, and the patient will develop septic shock. So, the patient will have a decrease in the blood pressure, the patient will have an increase in the heart rate, a decrease in the urine output, and most importantly, the patient will develop high grade fever, and there will be a well established source of infection in that case. So, for this, you have to stop the transfusion, you have to take the blood cultures and start broad spectrum antibiotics till the blood culture reports comes. Then we have the allergic or the anaphylactic reaction. Now it can develop within minutes. So there are certain signs which will help you differentiate it. So allergic reaction and acute hemolytic reaction occurs immediately. So how you differentiate? So for the anaphylactic shock or reaction, there will be severe urticaria, that is development of patches all over the body and severe itching. The patient will develop bronchospasm and the patient will start gasping for the air and there will be angioedema, and most importantly patient will develop features of shock. So, regarding the management of anaphylactic shock, the most important thing is stopping the transfusion and giving the patient adrenaline, antihistamine, and steroids. So, how can we give adrenaline? We will use 0.5 mg intramuscular adrenaline. Now, it is in the form of 1:1000. And now we have to give the patient this 0.5 mg intramuscular every 5 minutes till there is some response. Acute hemolytic reaction, stop the transfusion, check for the ID on the blood, because the most common reason for this is the clerical error. So that is high yield point to note. So once you have stopped the transfusion and you send the blood for the Coombs test and urine analysis.